now is Dr. Cedric Dark. He's an emergency medicine physician in Houston. Dr. Dark, I know how valuable your time is right now. I really appreciate you taking a few minutes to be here with us tonight. Thank you.
Thank you very much for having me on.
So I've just said a lot of words about Houston and about Texas and how things are. Let me just ask if that comports with your understanding, or if you feel like, from your perspective, we're talking about any of this in the wrong way or missing any of the important points.
I think you're right on about it. I mean, I was working a few days ago, and it was pretty obvious to me that there were no hospital beds for any patients that had COVID throughout the entire Houston area. And that's, ranging as far south as Galveston and upwards into the Woodlands. Nobody had any capacity to take care of a patient with coronavirus, and it is pretty a shame to say that that's the state of our city. It's very worrisome, and one of the things that I wish that Judge Hidalgo would do is to activate NRG so that we could have an escape valve for our overcrowded emergency departments.
How does that manifest for you as a doctor, you and your colleagues, when you've got a patient with COVID who needs care that you don't have room for, and you start looking for some place to transfer them to? Can you just tell us what that's like, and sort of what plan B is when you realize that you can't actually find a place to send them?
I mean, plan B is they stay in the emergency department, ultimately. What we tend to do if there's a patient that needs any kind of care, whether it's COVID care or some other kind of higher level of care, and they don't have space for that at their particular hospital, they have to seek a transfer, and it requires another hospital to have the capacity to be able to accept that patient. Otherwise, you can't transfer them. So in our case, if we're stuck in that situation, what we would have to do is continue to manage those patients in the emergency department on our own. And that's not something that we as emergency physicians necessarily want to do, because we're used to finding and diagnosing the problem and then getting the person to where they need to be. But unfortunately, we're put in a situation right now where we're having to function as either a hospitalist or as an internist or an intensivist if there's no space upstairs in the hospitals for us to care for our patients. This is what we saw in New York.
And does that have an impact? Does that have an impact on patients who have other emergency room presentations? I mean, people who don't have COVID or might be infected, but that's not what they're coming in for. Is that having an effect? Should people expect that that would have an effect in terms of the normal function of the ER and how people get care for all kinds of things?
It certainly can, because what happens is it can slow down the flow through the emergency department and back up waiting rooms. And therefore, if you are walking in, or your loved one's walking in with chest pain and they need to see a doctor to make sure they're not having a heart attack, every step along the way, if you slow down the output from the emergency department, then it's going to be slow on the input side, and that might lead to delays in care, which can ultimately cause devastating harm to patients that need it, whether or not they have coronavirus or if they have something like a heart attack or stroke or trauma.
You mentioned New York just a moment ago. I found myself thinking, actually just over the course of this hour, talking to the former director of the state health department in Arizona, talking to you right now, looking at these numbers. And I found myself thinking about Governor Andrew Cuomo in New York when New York was in the worst of it. And he's just in the last few days stopped doing his daily press briefings. But I remember him saying in the worst of it that New York would reciprocate, that he wanted other states to send health workers to New York because New York was in such a crunch. And he said, and when this happens to you, when this goes so badly in your state in the future, and it will, we will send people to you. Are we at a place where places like Houston, maybe places like Arizona, other places that are that hard hit, should start to think about tapping a sort of medical reserve corps from workers around the country, trying to tap national resources to protect your hospitals? It's very concerning to hear you say that already for the last few days, you got nowhere to send COVID patients.
I mean, the wonderful thing about Houston is there is like a doctor almost everywhere around and a nurse everywhere around this city because we are the home of the Texas Medical Center, which is the largest medical center in the world. So for right now, I don't think that the human resource is a problem. I think right now it's mostly the physical resources that we're struggling with and that we need a little help with.
Dr. Cedric Dark, emergency medicine physician in Houston, Texas. Again, your time right now is incredibly valuable. Thank you. Keep us apprised going forward. I'm hoping that there's going to be change in terms of resources available to you and your colleagues over the next few days. But we'd love to have you back anytime soon to let us know how things are going.
Anytime, just ask.